Hi, this is Dr. Bharadwaz. I am CEO and Homeopathy doctor at Fidicus Homeopathy. So once you have the cerebral palsy, what are all the changes that gets in the brain or in the body are known as body changes, and this is also known as pathology. Cerebral palsy is the damage to cerebral cortex or basal ganglion or cerebellum. So you have to understand these things very clearly. Next, you have to understand when there is damage to cerebral cortex, what will happen? This is known as spastic cerebral palsy. In spastic cerebral palsy, what happens is all your muscles become stiff and your movements are not coordinated. What happens in this? You will have muscle tone will be lost, and also there will be lot of hyperactive muscle reflexes. Your reflexes of the muscles increase, and there will be lot of resistance when you want to move his body, or when you want to move the part of his body. There will be lot of resistance. The muscles become so rigid. Spasticity means rigidity. So if there is a damage in the cerebral cortex, so this upper part or outer part of our brain, so this will be the effect. These are the symptoms that are seen, and this is the most common type of cerebral palsy. 70 to 80% of the people who are suffering with cerebral palsy will be landing into spastic cerebral palsy. This is the common one among the all the cerebral palsies. Next one is dyskinetic cerebral palsy. You can see when there is problem with the basal ganglion, when the basal ganglion, which is located deep in the brain, is damaged, land into dyskinetic cerebral palsy. Dyskinetic cerebral palsy, there will be lot of involuntary and uncontrolled movements. So the main function of this basal ganglion is to control the movement, that is lost. So you have lot of involuntary movement. For example, if you want to take the pen, you have to go straight and grab the pen, right? No, it will be shaky like this. Okay, so there are a lot of involuntary movements when you try to perform a voluntary movement. And also muscle tone fluctuates. So sometimes the muscle becomes strong, sometimes muscle become weak, your muscles become rigid, sometimes your muscles become flaccid and loose. So a lot of changeability you see when there is damage to the basal ganglia. The movements can be slow, you cannot be fast. So someone asks you to grab a pen or glass of water, you cannot do it quickly, you have to do it very slowly. And also there can be jerky movements, so you cannot do there cannot be smooth movement and without jerks. So basal ganglion is damaged, there will be jerks as well. And the third variety of cerebral palsy is ataxic cerebral palsy. Ataxic cerebral palsy is caused due to damage of the cerebellum. Cerebellum is the part of the brain located behind the skull, lower part of the skull and behind the skull. So if this part is damaged, what will happen? The important damage is going to be to the balancing. While walking or sitting or play doing something, you cannot have balance in your body. That balance in your body is lost. And also there will not be any coordination. There will not be coordination between your hands and between your legs and hands, or any part of the body. That coordination is lost. And also gait, when you are walking, you cannot walk normally. There can be widening gait or different types of gait, and stability problems are associated with these persons when their cerebellum is damaged. These are the various kinds of cerebral palsies. Next one is mixed cerebral palsy. We have seen three types of cerebral palsies, right? But in a patient, it will not be separate. One patient cannot have only one types of cerebral palsy. It will be a mixture. Sometimes symptoms of one variety can be more, symptoms of one variety can be less, but it is always a mixture. That's the reason we call as mixed cerebral palsy. Pure cerebral palsy, getting only one type of cerebral palsy, is very rare, and normally for 95% of the patient it will be mixed. It will be dyskinetic. They will have some symptoms of dyskinetic cerebral palsy or ataxic cerebral palsy or spastic cerebral palsy. So it will be always a mixture of these symptoms in a patient. That's the reason we name it as mixed cerebral palsy in most of the cases.
Fidicus Homeopathy.